Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article Health-Related Quality of Life Results from the open-label randomized Phase 3 ASPIRE trial evaluating carfilzomib, lenalidomide, and dexamethasone versus lenalidomide and dexamethasone in patients with relapsed multiple myeloma by Stewart et al. My name is Ola Landgren, and I am Professor of Medicine and Chief of the Myeloma Service at Memorial Sloan Kettering Cancer Center in New York City. My oncologic specialty is multiple myeloma and related disorders. In 2016, multiple myeloma will affect about 25,000 Americans. Almost 100,000 Americans are currently living with multiple myeloma. A few years ago, using older drugs followed by high-dose melphalan and autologous stem cell transplantation, only a smaller fraction of multiple myeloma patients obtain a complete response. Today, using modern combination therapies with or without the addition of high-dose melphalan with autologous stem cell transplantation, 100% of patients achieve a treatment response, an overall response, with up to 80% of these patients reaching a complete response. Both progression-free survival and overall survival are associated with a deep clinical response. At the start of the 21st century in the United States, multiple myeloma had an average overall survival of about 3 years. Driven by access to better drugs, patients 50 years or younger had more than 10 years median survival in the year of 2014. In the United States, Food and Drug Administration, the FDA, approved 14 new drugs in the treatment of cancer in 2015. 4 of these were approved for the treatment of multiple myeloma: panobinostat, daratumumab, elotuzumab, and ixazomib. In 2015 and 2016, expanded label indications were FDA approved for lenalidomide and carfilzomib respectively. Driven by access to modern therapies, multiple myeloma has become the poster child for significantly improved cancer survival in the 21st century. The study by Stewart et al. That accompanies this podcast is important in that it's focusing on the quality of life in the setting of effective modern myeloma therapy. Consistent with the literature for other hematologic and solid tumors, the bulk of the myeloma literature is focusing on efficacy and drug safety. Clinical improvements are measured as months of longer progression-free and overall survival. As we move into the future with modern drug combinations, without any question, in parallel with improved efficacy driven by modern therapies, it will be increasingly important to capture and assess quality of life data. As pointed out by Stewart and colleagues, many patients with relapsed multiple myeloma experiencing the relapsing disease as an acute and chronic condition at the same time. Functional impairment from disease-related and treatment-related symptoms combined with the overall burden of a terminal diagnosis clearly affect quality of life. In the ASPIRE trial, relapsed multiple myeloma patients were randomly assigned to receive carfilzomib, lenalidomide, and dexamethasone, referred to as KRD in this podcast, versus lenalidomide and dexamethasone, referred to as RD. Beyond traditional outcomes reflected in significantly improved progression-free survival for KRD versus RD, median 26.3 months versus 17.6 months, hazard ratio of 0.69, and a p-value equal to 0.0001. The trial had health-related quality of life as a pre-specified secondary endpoint, measured by established subscales which provide a measure of the overall impact of multiple myeloma and its treatment from patient's perspective. The health-related quality of life component is the focus of the current study. In brief, the European Organization for Research and Treatment of Cancer Core Quality of Life Questionnaire, the QLQ-C30, and the myeloma-specific module, QLQ-MY20, were administered at baseline, day 1, of cycle 3, 6, 12, and 18, and post-treatment. The global health status and the quality of life, the GHS-QOL, had 7 subscales. The subscales were fatigue, nausea and vomiting, pain, physical functioning, role functioning, disease symptoms, side effects of treatment. These were compared between groups using a mixed model for repeated measures. Percentages of responders at each cycle were compared between groups. As shown in detail in the results section of the paper, the baseline questionnaire compliance was very high, 94% of the randomized patients. The main results show that a higher proportion of KOD patients met the global health status quality of life responder definition, 5 points or greater improvement, with statistically different cycles. The difference at cycle 12 was 25.5% for KOD versus 17.4% for RD. And cycle 18, it was 24.2% for KOD versus 12.9% of RD. There was no difference between the groups for the other pre-specified subscales. Taken together, the study shows that KOD improved the global health status, the quality of life, without negatively affecting patient-reported symptoms when compared with RD. These findings further support the benefit of KOD in patients with relapsed multiple myeloma. As we move into the future with modern drug combinations, patients with multiple myeloma will continue to live longer and longer. As a consequence, as clinical researchers and treating physicians, we will have to increase our focus on quality of life. In my opinion, future clinical trials using modern therapy have a responsibility to capture and assess quality of life data in parallel with traditional data focusing on efficacy and drug safety. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.